Most patients don't fail because they don't care. They actually fail because they're overwhelmed. In fact, behavioral health studies have shown that people retain only 10% of what they hear in one session, but retention increases by 75%. So repeat, 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 and reinforce. That is what is going to help people to really learn what they need to do and how they need to integrate in what they're learning. If you're new to my channel, welcome. My name is Dr. Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. So we are in week 11 of Intro to Holistic Medicine. Oh my gosh, the time has flown by. It is a self-paced course. You still have time to register if you'd like. You can just go ahead and click the link in the bio, scroll down and enroll, and then begin your course experience. So Intro to Holistic Medicine 1 is all about replenishing nutrients that are lacking, and you'll begin to learn subjective and objective data to be able to determine what you need specific to you. And then Intro to Holistic Medicine 2, which will be starting in about a month, goes over detoxification and all things about healing your body through detox. Okay, so if you have been struggling with all of the information we've provided, you've come to the right place. So when we first start really teaching our patients what they need to do, a lot of times patients can be extremely overwhelmed, and that's common. A lot of the information is incredibly new. It's difficult to juggle all of the things that we have in your life. So we tend to teach in layers. So what does that mean? Meaning that we're going to start with practical step-by-step practices. So instead of, let's say, starting with detoxification, which everybody wants to, we need to first hydrate, because if we don't have proper hydration and we detox, then unfortunately the body can go off of balance and get unwell. So detoxification wouldn't be indicated in a case where a person is dehydrated. The other thing is that we really break things down. We chunk it down. I like to do those 12 weeks where each week is very intentional, and we make sure that each week has ladders and scaffolding so that it's progressive. So slowly but surely you're building. So maybe this week it's hydration, and then as you develop that hydration skill over the next couple weeks, then you're going to build into protein and then movement, et cetera, et cetera, et cetera. Therapeutic order is always going to be our roadmap, meaning that we're always going to go back to the basics. We're going to look at our foundations. We're going to support those weak organ systems and then slowly kind of build from there. We're not going to jump into that reactive state because, again, that's conventional practice. That is what patients are leaving, that conventional medical model, and that's not what we do as holistic providers. Having that one goal every single week actually does a lot of things. It gives that patient a little bit of motivation. It helps them to reinforce positive behavior, because if you get a little success, it's like, yes, perfect, I drank enough water. And so we want to, again, really reinforce what we're teaching. So we may have a big overview with people, but then we're going to break it down step by step, and using that therapeutic order as a teaching hierarchy. So many times people come to us highly reactive from the conventional medical model, and they run to us looking for something different. And we want to offer them something different, because it's not our practice to diagnose and manage diseases. In fact, it's our job to teach people what they need to do to reclaim their health. The other thing is we don't want to just info dump. I know that can be tempting when we're really excited about the information and we want to help, but we want to introduce a concept, revisit them, and then allow that patient to reflect so that they have time again to integrate the information, especially if it's new concepts. And then as we're reinforcing that information, we're going to do that through action, not just lecturing. So giving people practical skills. That's why I love the subjective and objective. So subjective is how the person feels, thinks, etc. Objective is some sort of something outside of you, some data, mostly like a pH test or something like that, outside of me, outside of you, that then I can use to be able to track. And speaking of tracking, we often use things like checklists, journaling, app features, really to layer the content, but also to keep people focused, because again, a lot of new information. So if you're interested in learning more about how you can use holistic medicine to help you and your family live naturally, go ahead and click the link in the bio, and always like, share, and subscribe for more.